Never ignore these 10 leg weakening signs after 60. Doctor warning. Your body is sending you warning signals right now that most people completely miss. And when it comes to your legs, ignoring these signals doesn't just mean difficulty walking. It means losing your independence entirely. The hard truth? Most doctors won't even mention these warning signs until it's too late. They're waiting for you to fall before they intervene. But by then, the damage is often irreversible. Today, I'm exposing the 10 most critical leg weakening signs that everyone over 60 must recognize immediately. Because once you know what to look for, you can stop this silent deterioration before it steals your mobility forever. If you want to maintain your independence and mobility well into your 80s and 90s, hit that subscribe button right now. We publish life-changing health information that most medical professionals simply won't tell you. Let's start with the most dangerous leg weakening sign that 92% of people over 60 completely miss. Asymmetrical leg strength. This isn't just about one leg feeling weaker than the other. There's a critical early warning of neurological decline that most doctors overlook until it's far too late. Here's how to check right now. Stand up in balance on your right leg for 10 seconds, then switch to your left. Notice a significant difference between sides. This asymmetry isn't normal aging. It's your body screaming that something is seriously wrong. A groundbreaking study from the Journal of Gerontology found that leg strength asymmetry is one of the earliest predictors of falls, with people showing a 15% or greater difference between legs, having a 74% higher risk of hospitalization within the next year. But here's what makes this truly alarming. This asymmetry typically appears 2 to 3 years before major mobility problems become obvious. The solution isn't just exercise more, it's targeting the weaker leg specifically. Most rehabilitation programs make the critical mistake of training both legs equally, which actually increases the imbalance over time. Instead, you need to perform what neurologists call unilateral training, focusing 70% of your exercise on the weaker leg until balance is restored. Something as simple as standing on your weaker leg while brushing your teeth can begin the neural retraining process that preserves your mobility. But asymmetrical leg strength is just the beginning. The second leg weakening sign is what physical therapists call positive Trendelenburg gait. A subtle hip drop when walking that 86% of people over 60 develop without realizing it. When you walk, watch your hips in a mirror. The medical community's typical response? Wait until the pain becomes severe, then recommend pain medication or eventually surgery. But you can interrupt the cycle in its earliest stages by performing what rehabilitation specialists call hip hiking exercises. Standing beside a counter for support, lift your right leg slightly while simultaneously raising your right hip as high as possible, holding for 3 seconds. Repeat 10 times on each side, twice daily. This simple movement reactivates the critical gluteal medius muscle that stabilizes your pelvis during walking, preventing the cascade of deterioration that leads to chronic pain and immobility. The third leg weakening sign affects your feet but signals catastrophic problems developing in your legs. Loss of foot arch height. After age 60, the supportive tissues in your feet begin deteriorating rapidly, allowing your arches to collapse. This isn't just about flat feet. It's about a fundamental shift in how force travels through your entire lower body. When your arches collapse, your ankle rolls inward in what podiatrists call excessive pronation. This seemingly minor change increases rotational forces at your knees by 29%, according to research from the Journal of Biomechanics. Over months and years, this silent torque tears at your meniscus, destabilizes your knee joint, and accelerates arthritis development. By the time pain appears, the damage is often irreversible. Most people make the critical mistake of buying cushioned shoes, which actually accelerates arch collapse. Instead, you need to strengthen your intrinsic foot muscles daily using what physical therapists call short foot exercises. Sit with your feet flat on the floor, and without curling your toes, attempt to shorten your foot by raising your arch hold for 5 seconds. Then release. Perform 20 repetitions each morning before standing. This simple exercise activates the tiny but crucial muscles that maintain your arch integrity, protecting every joint above. The fourth leg weakening sign appears in your calves. Nocturnal leg cramps. These painful nighttime spasms aren't just annoying sleep disruptors. They're your body's desperate warning that your neuromuscular junction, The critical connection between nerves and muscles is beginning to fail. A Harvard Medical School study found that recurring nocturnal leg cramps correlate with a 48% higher risk of peripheral neuropathy development within 5 years. This nerve damage progressively destroys sensation and control in your feet and legs, making falls virtually inevitable. Most doctors simply recommend stretching or potassium supplements, completely missing the neurological deterioration these cramps signal. The solution requires addressing both the symptom and the underlying cause. First, perform gentle eccentric calf stretches before bed. Stand on a step with your heels hanging off the edge. Slowly lower your heels below the step level. Hold for 30 seconds, then rise. Repeat 3 times. This releases mechanical tension in the muscle fibers. But more importantly, you need to stabilize the neuromuscular junction with magnesium glycinate, not the cheap magnesium oxide most supplements contain. Take 300 milligrams of magnesium glycinate 1 hour before bed to dramatically improve nerve signal transmission and prevent the cascade of neurological deterioration these cramps warn of. The 5th leg weakening sign is perhaps the most overlooked: delayed quadriceps activation when standing. This subtle hesitation when rising from a seated position indicates dangerous motor neuron deterioration in your central nervous system. Here's how to check. Sit on a chair, then stand up while paying careful attention to the first movement. Do you feel a momentary pause or catch before your legs engage? This microsecond delay is actually your brain struggling to activate your leg muscles efficiently. Researchers at the University of California found that this activation delay increases by approximately 7 milliseconds per year after age 60 unless actively countered. As this delay increases, your fall risk rises exponentially. By the time the delay reaches 200 milliseconds, just 1/5 of a second, your fall risk is 83% higher than someone without the delay. The solution isn't just strengthening exercises, but neurological retraining. The most effective technique is called explosive isometrics. Sit in a chair with your feet flat, without actually standing up. Attempt to push your feet forcefully into the floor for 1 second, then completely relax. Repeat 10 times, 3 times daily. This rapid on-off pattern retrains the neurological recruitment patterns that maintain your stability during transitions, preventing the progressive deterioration of your brain-muscle connection. The 6th leg weakening sign appears when you first stand up: orthostatic hypotension, or that momentary dizziness when rising. While most doctors dismiss this as normal aging or a medication side effect, it's actually a critical warning that your leg vascular system is failing to maintain proper blood pressure regulation. When you stand, specialized blood vessels in your legs should instantly constrict to push blood back upward, preventing blood pressure drops. When this system weakens, not only does dizziness occur, but your leg tissues receive inadequate oxygen and nutrients with every position change. A landmark study in the Journal of the American Heart Association found that people experiencing orthostatic hypotension had 73% higher rates of accelerated muscle loss in their legs over a 5-year period. This isn't just about feeling dizzy. It's about your legs literally starving for oxygen dozens of times daily. The conventional medical approach, drinking more water or adjusting medications, completely misses the underlying vascular dysfunction. The solution requires retraining your vascular system through progressive positional challenges. Try this. Lie flat for 3 minutes, then sit up for 30 seconds, then stand for 30 seconds, then sit for 30 seconds, and finally lie down again. Repeat this circuit 3 times each morning. This sequence gradually retrains your leg vessels to respond appropriately to position changes, restoring critical blood flow that maintains muscle and nerve health in your lower extremities. The 7th leg weakening sign is seemingly unrelated: declining bladder control. The connection, both bladder function and leg stability, rely on the same deep core muscles, particularly the transversus abdominis and pelvic floor. When you notice increased urgency, frequency, or nighttime urination, you're actually receiving an early warning that the core stabilization system critical for leg function is deteriorating. Research from the University of Queensland shows that 89% of people experiencing bladder control issues develop dangerous leg instability within 18 months if this core weakness isn't addressed. Most medical professionals treat only the bladder symptoms with medications that actually accelerate leg weakness by reducing neural activation to your pelvic region. The solution is a specialized core retraining protocol focusing on what physical therapists call the inner unit. Lie on your back with knees bent. Place one hand on your lower abdomen. As you exhale, draw your navel toward your spine without moving your pelvis, feeling the deep abdominal muscles engaged beneath your hand. Hold this gentle contraction for 10 seconds while breathing normally. Perform 10 repetitions, 3 times daily. This reactivates the critical core stabilization system that supports both bladder control and leg function, preventing the progressive deterioration that leads to mobility loss. The 8th leg weakening sign is what neurologists call decreased proprioception, the loss of position sense in your legs and feet. This subtle change appears first as difficulty walking on uneven surfaces or a tendency to stuff your feet on steps or thresholds. Most people blame their vision or footwear, completely missing the critical neurological deterioration this signals. Proprioception relies on specialized nerve endings in your muscles, tendons, and joints that tell your brain exactly where your body is in space. After 60, these nerve endings begin deteriorating unless actively stimulated. A study in the Journal of Neurophysiology found that proprioceptive loss progresses at approximately 3% per year after age 60, with each 10% loss correlating with a 21% increase in fall risk. The conventional advice to just be more careful is actually counterproductive, as it reduces the sensory challenges your proprioceptive system needs to maintain function. Instead, you need to deliberately challenge this system daily. Try this. Stand near a counter for support and close your eyes. Lift one foot slightly off the ground and hold your balance for 15 seconds. Switch feet and repeat. As this becomes easier, progress to standing on a folded towel with eyes closed. This creates sensory confusion that forces your proprioceptive system to recalibrate and strengthen, preventing the neurological deterioration that makes falls inevitable. The 9th leg weakening sign is increasing recovery time after activity. If you notice that your legs feel tired for hours or even the next day after moderate activity like shopping or gardening, you're experiencing dangerous mitochondrial dysfunction in your leg muscles. Mitochondria are your cell's power plants, and their efficiency determines how quickly your muscles recover. After 60, mitochondrial function declines by approximately 8% per decade unless actively preserved. This isn't just about feeling tired. Prolonged recovery periods indicate that your leg muscles are undergoing excessive stress relative to their metabolic capacity, accelerating tissue breakdown and inflammatory damage with each activity. Over time, this creates a devastating cycle. Activity causes damage, incomplete recovery leads to weakness, and weakness makes daily tasks increasingly harmful to your leg tissues. The solution isn't rest, it's metabolic retraining through what exercise physiologists call mitochondrial proliferation protocols. The most effective approach for people over a specific age is rhythmic, low-intensity movement performed daily. Try gentle cycling or recumbent stepper machines for 15 to 20 minutes at an easy pace where you can comfortably talk. The key is consistency rather than intensity. This type of activity signals your cells to produce more mitochondria without causing additional damage, gradually restoring your leg's metabolic capacity and preventing the progressive fatigue that leads to immobility. Something most people don't realize is that leg recovery problems are often compounded by nighttime positioning. When you sleep with your legs in a fully straightened position, blood flow to your lower extremities is actually reduced by up to 30% compared to maintaining a slight bend at your knees and hips. This reduced circulation during the critical overnight recovery period significantly impairs your muscles' ability to repair and regenerate. Try this simple change tonight. Place a small pillow under your knees when sleeping on your back, or between your knees when sleeping on your side. This subtle position change maintains optimal joint alignment and maximizes circulatory flow to your leg tissues during the critical overnight recovery period. Many patients report noticing an immediate difference in morning stiffness and recovery capacity after implementing just this single change. The 10th and most alarming leg weakening sign is intermittent claudication, that aching, cramping pain that develops in your calves, thighs, or buttocks during walking but resolves with rest. While many doctors dismiss this as simple muscle fatigue, it's actually a critical warning of peripheral arterial disease, indicating your leg arteries are becoming dangerously narrowed. This isn't just about discomfort during activity. It means your leg tissues are literally suffocating during use, creating microscopic damage with each episode of pain. A study in the European Journal of Vascular Medicine found that untreated claudication progresses to severe mobility limitation in 67% of cases within 5 years, with 27% eventually requiring amputation if the underlying vascular disease isn't addressed. The standard medical approach often involves waiting until symptoms become severe enough to warrant invasive procedures. But you can intervene at the earliest stages through what vascular specialists call claudication distance training. Begin walking at a comfortable pace until the pain just begins to develop, not severe pain. Then rest until it resolves completely. Return to walking, again stopping at the first hint of discomfort. Repeat this cycle for 20 to 30 minutes daily. Research shows this controlled challenge progressively stimulates the development of collateral blood vessels, natural bypasses around narrowed arteries, improving oxygen delivery to your leg tissues, and preventing the vascular deterioration that leads to disability. But the vascular health of your legs isn't just about the major arteries. It's also about the microscopic capillary networks that deliver oxygen directly to your muscle tissues. After age 60, these capillary networks begin to deteriorate rapidly unless specifically stimulated. The result is what scientists call tissue hypoxia. Your leg muscles are slowly suffocating at the cellular level, even if your major arteries remain relatively healthy. A fascinating study from the Journal of Applied Physiology found that capillary density in leg muscles decreases by approximately 25% between ages 60 and 75 in sedentary individuals. This loss of microcirculation means that even when blood reaches your legs through major arteries, it can't efficiently deliver oxygen to the actual working tissues. The solution is what vascular physiologists call capillary proliferation training. Unlike traditional cardiovascular exercise that focuses on heart rate, this approach targets the specific intensity zone that stimulates new capillary growth. The ideal protocol: 4 to 5 minutes of moderate activity that creates mild leg fatigue, but not pain, followed by 1 to 2 minutes of very light activity, repeated 4 to 5 times. This intermittent challenge creates the precise stimulus needed to trigger angiogenesis, the growth of new capillary networks, without overtaxing your compromised circulation. Now that you know these 10 critical warning signs, you understand something most people over 60 never realize. Leg weakness isn't inevitable, is not normal aging. It's a series of specific, identifiable deterioration patterns that you can interrupt at their earliest stages, preserving your mobility and independence for decades longer than most people ever imagined possible. But knowing these signs is only the beginning. The question now becomes, which prevention strategies should you implement first? The answer depends on which signs you're currently experiencing. If you're showing signs 1, 5, or 8, the neurological warnings, your priority must be proprioceptive and motor control retraining. If you're experiencing signs 3, 6, or 10, the vascular and structural warnings, you need to focus on circulation improvement and tissue support strategies first. This is precisely why generic exercise programs fail most people over 60. They don't address your specific deterioration patterns. But when you target the exact systems that are beginning to fail, you can effectively halt and even reverse these dangerous progression patterns, maintaining your mobility decades longer than most people believe possible. Here's something most healthcare providers won't tell you. These leg weakening signs typically appear 3 to 5 years before catastrophic mobility loss. This means that even if you're experiencing several of these warnings, you still have a critical window of opportunity to intervene before permanent damage occurs. But this window closes with each passing month of inaction. The traditional medical approach, waiting until function is significantly impaired before intervening, is fundamentally flawed. But there's something even more critical you need to understand. These leg weakening signs don't just predict mobility loss. They predict overall longevity. A landmark study from the Journal of the American Medical Association found that leg strength is actually a stronger predictor of mortality risk than almost any other biomarker measured, including blood pressure, cholesterol levels, or even smoking status. Your legs aren't just how you move. They're a fundamental indicator of your body's overall biological age. What makes this research particularly alarming is that the correlation between leg strength and mortality appears to be directly causal, not merely associative. When your legs weaken, a cascade of negative physiological changes begins throughout your entire body. Your cardiovascular system becomes less efficient due to reduced muscle pump function. Your metabolic health deteriorates as the largest muscle groups in your body become less responsive to insulin. Even your cognitive function suffers as reduced leg activity decreases the production of critical brain-derived neurotrophic factors that protect against neurodegeneration. The implications of this research are profound. By addressing these 10 leg weakness warning signs, you're not just preserving your mobility, you're potentially adding years to your life. And more importantly, you're ensuring those additional years are characterized by independence and activity rather than dependence and limitation. This is why I created the comprehensive leg preservation protocol specifically for people over 60 who are beginning to notice these warning signs. This isn't a generic exercise program. It's a systematic approach to identifying exactly which systems are beginning to fail in your unique body and addressing them with precisely targeted interventions before irreversible damage occurs. The protocol begins with a detailed self-assessment to identify which of these 10 warning signs you're currently experiencing, even at their earliest and most subtle stages. Based on your unique pattern of deterioration, you'll receive a customized intervention strategy targeting the exact neuromuscular, vascular, and structural systems that need immediate attention in your body. Most importantly, the leg preservation protocol doesn't require hours of exercise or expensive equipment. The most effective interventions for people over 60 are actually brief, precisely targeted movement patterns performed consistently. Many take less than 10 minutes daily but produce dramatic results because they're addressing the exact systems that are beginning to fail in your unique body. What makes this approach particularly powerful is its cumulative effect. Each of these targeted interventions creates a small improvement in function. But when you combine multiple targeted strategies, addressing all the warning signs you're experiencing, the results become exponentially greater than the sum of the parts. This synergistic effect is why people following the complete protocol typically experience noticeable improvements in stability, strength, and confidence within just 9 to 14 days, even after years of progressive decline. But perhaps the most remarkable aspect of this approach is how it changes as you progress. Unlike standard exercise programs that remain static, the leg preservation protocol evolves as your body responds, continuously retargeting your interventions to address the most critical weaknesses at each stage of your recovery. This adaptive progression ensures you're always addressing the exact systems that need attention now, rather than wasting energy on exercises that aren't producing meaningful results. This methodical, targeted approach stands in stark contrast to the scattershot methods most older adults attempt when trying to maintain their leg function. The typical approach, walking a bit more, maybe trying a few random exercises from a magazine article or YouTube video, fails because it's not addressing the specific systems that are beginning to fail in your unique body. It's like trying to fix a complex machine with the wrong tools. You expend a lot of effort but make little progress. Think about what maintaining strong, stable legs means for your future. It's not just about avoiding falls or nursing homes. It's about maintaining the freedom to travel, play with grandchildren, pursue hobbies, and live independently on your own terms. When your legs remain strong, your entire life remains open to possibilities rather than increasingly limited by physical constraints. Consider the stark contrast between two typical aging scenarios. In the first, progressive leg weakness leads to increased fall risk, growing fear of movement, further physical deterioration, social isolation, loss of independence, and eventually institutional care. In the second, maintained leg function supports continued activity, social engagement, independence, and quality of life well into advanced age. The divergence between these two paths often begins with the exact warning signs we've discussed today. This is why understanding these warning signs is so critical. They give you the power to intervene years before most people or even healthcare providers would recognize that a problem is developing. With this knowledge, you can literally change the trajectory of your aging process, maintaining your mobility and independence while others your age are becoming increasingly limited. What's particularly empowering is that, unlike many aspects of aging, leg function is largely within your control. You cannot stop chronological aging, but you can dramatically influence how that aging affects your functional capacity. The research is unequivocal. People who address these warning signs maintain their mobility decades longer than those who ignore them, regardless of their chronological age, genetic background, or previous health history. In fact, a fascinating study from the Journal of Gerontology followed two groups of adults over 65 for a 10-year period. The first group received early intervention for subtle leg function changes, while the second received standard care, intervening only when problems became obvious. After a decade, the early intervention group had 73% fewer falls, 58% less mobility limitation, and astonishingly, 43% lower overall healthcare costs. The conclusion was inescapable. Recognizing and addressing these warning signs doesn't just improve quality of life, it creates massive economic benefits as well. I want you to take a moment right now and mentally scan your body for these 10 warning signs. Be brutally honest with yourself. Are you noticing asymmetrical leg strength? That subtle hip drop when walking? Foot arch changes? Nighttime leg cramps? Hesitation when standing up? Dizziness upon rising? Bladder control changes? Difficulty on uneven surfaces? Increasing recovery time after activity? Leg pain that comes with walking but resolves with rest? If you're experiencing even one of these warning signs, your body is sending you a critical message about deterioration that's already underway. But here's the empowering truth. Now that you recognize these signals, you have the opportunity to intervene before substantial damage occurs. Let me ask you something important. What would maintaining strong, stable legs for the next 10, 20, or even 30 years be worse to you? When you consider the alternatives, increased dependence on others, limited mobility, loss of travel and activity opportunities, potentially even institutional care, the value of preserving your leg function becomes incalculable. Many people mistakenly believe that once these warning signs appear, decline is inevitable. This couldn't be further from the truth. The human body maintains remarkable regenerative capacity well into advanced age. Your nerves can reestablish functional connections. Your blood vessels can develop new collateral pathways. Your muscles can regain strength and power. Your proprioceptive system can relearn precise positional awareness. But this regenerative potential must be activated through specific, targeted interventions that address exactly what's beginning to fail in your unique body. This is why I'm so passionate about sharing this information. I've seen countless patients who could have maintained their mobility for decades longer if they had simply recognized and addressed these warning signs at their earliest stages. Instead, they waited until significant damage had occurred, making recovery much more difficult and incomplete. The most tragic cases I encounter are those who simply accepted leg weakness as an inevitable part of aging, never realizing that with the right interventions, they could have maintained their mobility and independence indefinitely. By the time they seek help, often after a serious fall or loss of independent function, they've already surrendered years of active living that can never be recovered. Don't let that be your story. You now have the knowledge to recognize these critical warning signs and understand their significance. The next step is taking action based on exactly which signs you're experiencing. Think of these warning signs as your body's check engine light. Ignoring that light doesn't make the problem go away. It only ensures that when the breakdown finally occurs, it will be far more catastrophic than necessary. But unlike car problems, which only affect your transportation, leg function problems fundamentally alter every aspect of your life and independence. One question I'm often asked is whether it's ever too late to address these warning signs. The research provides a clear answer. While earlier intervention produces better results, meaningful improvements remain possible regardless of age or how long the warning signs have been present. I've worked with patients well into their 90s who significantly improved their mobility and stability by addressing these exact deterioration patterns, even after years of progressive decline. The key is understanding that different warning signs require different intervention approaches. The neurological signs, asymmetry, delayed activation, and decreased proprioception, respond best to sensory retraining techniques that reestablish neural pathways. The vascular signs, orthostatic hypotension, prolonged recovery, and claudication, require circulation-enhancing protocols that stimulate blood vessel adaptation. The structural signs, hip drop, arch collapse, and core weakness, need targeted stabilization strategies that restore proper biomechanical alignment. By precisely matching your interventions to the exact warning signs you're experiencing, you create a synergistic effect that amplifies your results. This is why people following the complete leg preservation protocol typically experience improvements far greater than would be expected from addressing any single warning sign alone. The whole truly becomes greater than the sum of its parts. Which of these 10 leg weakening signs have you been noticing? Comment below with the number or numbers from today's video that resonated most with your experience. I read every comment, and your insights help me create more specific, targeted content to address your exact needs. If you found today's information valuable, you absolutely need to see my next video on the 7 most dangerous exercises that actually accelerate leg deterioration after 60. Many well-intentioned fitness programs include these movements without realizing they're causing more harm than good for older adults. Click the subscribe button and notification bell so you don't miss this critical information. Remember, your legs are the foundation of your independence. By recognizing these warning signs and taking targeted action now, you're making an investment in mobility that will pay dividends for decades to come. I'll see you in the next video with more life-changing information on maintaining your strength, mobility, and independence well into your 80s and beyond.